Mr. Mike Gapes.
Thank you, Mr. Speaker, and it's a pleasure to be called before 10 o'clock. I wish to begin by saying that earlier this evening I was at a celebration function organised by the Barking, Havering and Redbridge University Trust, celebrating the fact that they, after 3 years, came out of special measures in March. And this event was a very good occasion because it enabled me to get even more up-to-date information before this debate. They have published 10 tips to climb out of special measures, and I'm sure that other NHS trusts may find this valuable. They've also published a booklet, The Only Way Is Up, which is original and details the strenuous efforts made by all the staff and the management and various people that they were engaged with in order to achieve this great progress. And I have to say, in my 25 years in this House, I've often had to bring to the attention of the House and the government problems in the NHS in my area. This is not the first time I've talked about the future of King George Hospital. And although the hospital, which is one of the 2 hospitals with Queen's Hospital Romford within our trust, is now improving and is under the best management, in my opinion, that it has ever had in 25 years, there are still clouds on the horizon. Firstly, there is inexplicably a delay in an announcement about the future of the North East London NHS Treatment Centre, where I understand there is some difference of opinion between local CCGs. And I have to declare an interest. I had an operation on my nose in that facility a few years ago and found it to be very good. But there is an argument, a very strong argument, that that facility could be brought in-house within the NHS and no longer provided by Care UK as a provider. And that would allow greater flexibility on site for longer planning of what might happen at King George Hospital. Secondly, I referred to clouds on the horizon. There's the ongoing social care crisis, which has impacted in my local authority and neighbouring local authorities very much, linked to the 40% cuts in funding for a Redbridge local authority that we have had, and also on the one hand, an ageing population, but secondly...
Order. 10 o'clock motion. The whip to move.
To move, Mr. Speaker, that this House do now adjourn.
The question is that this House do now adjourn. Mr. Mike Gapes.
Thank you, Mr. Speaker. The ongoing social care crisis, which has major difficulties. We all know that private care homes are struggling and that there is an issue of quality. And one advantage, it seems to me, of the King George Hospital site is that it is co-located next door to the facilities of the North East London Foundation Trust, Goodmayes Hospital and its various other facilities that provide support for people with learning difficulties, people with acute and severe, but also with minor, less severe mental health problems. And it would seem logical, if we are going to have joined up NHS treatment, that we could have alongside a hospital facilities for those who would need short-term, temporary, or maybe longer care in a transition either to or from the NHS facilities next door. This site is big enough to do that, and with imagination it could be a model which could be followed. We also have a third cloud on the horizon, which is the North East London Draft Stability and Transformation Plan. And the Minister will recall that he and I had a very useful meeting in February when I met him and his then colleague, Mr. David Mowat. We had a very useful discussion about the implications of the huge deficit in North East London, £586 million, and the potential cuts that would be huge in the budget over the next 4 years, and the implications that would have. I raised this in detail in the debate on the 16th of December 2016, and that was why, following that, I had the meeting with ministers. I have to say, I'm very concerned that the funding gap, even if we have predicted regular savings within the NHS of around £220 million or 240 million, would still be £336 million by 2021. And one of the most worrying points about this plan, and I understand it's still a draft, it's not been signed off, but I went to a meeting last week where the people involved in this organisation looking at the plan were discussing it, and reference was made by senior figures in the London NHS to the plan, and they said you have to work on the basis of the plan. The plan has not been signed off, it has not been approved yet, but the people within the NHS health economy in North East London are thinking ahead as though it will be. And one of the points in that plan points out that the population of the North East London boroughs will increase by 18% over the next 15 years. And that is equivalent to a new city. Normally, with that level of population increase, you would need a new hospital. But there is no provision and no funding and no expectation of a new hospital. Instead, what is proposed, and it is still in the plan, is the downgrading of the existing King George Hospital in my constituency and the accident and emergency department to be taken away. Now, this is not a new proposal. In fact, I've been campaigning to save the A&E in my constituency for more than 10 years. But formally, the decision was only taken by the former Health Secretary, Andrew Lansley, in 2011. That decision, linked at that time to a suggestion of closing the maternity services at King George Hospital, said that those two things would happen in around 2 years. That was October 2011. The reality is the maternity services did go in early 2013. They went to Queen's and there have been improvements. I don't question that. But the A&E could not close. There was no capacity at other hospitals in the region, in the area, and in addition, it was quite clear that it required huge capital investment that was not forthcoming. So, 2011, decision. 2013, no action. Issue was deferred. And then, because of a variety of issues, the Trust got into the special measures 3 years ago, to which I've already made mention. When the Trust came out of special measures, of course, then the question becomes, does it then go ahead with the plans to close the A&E? I know that it is impossible, practically, for that closure to happen soon. But the plan, the Stability and Transformation Plan, still says that it's intended to close the A&E in 2019. The original suggestion was that from September this year, they would stop having a 24-hour service and they would get rid of the overnight A&E. In January, that was dropped, which I welcome. But the reality is, it is still in the plan and it is still proposed, and this cloud still hangs over this trust and all the excellent staff who have done so much to bring our hospital out of special measures. I give my way to my honourable friend.
I'm grateful to my honourable friend for giving way and congratulate him on securing this important debate. In my capacity as a Labour councillor in the London Borough of Redbridge, I'm currently chairing, as he knows, a cross-party working group on the future of A&E provision in North East London. And one of the frustrating things is that all of the local health leads in the area are working to a decision made by a previous Secretary of State, the ministerial decision which still stands. They have to work towards it. They don't believe that it's achievable. They don't believe it's clinically sound. And yet, when pressed to abandon the plans, they point to the Secretary of State. So I hope that the Minister, in his response, might be able to reverse the ministerial decision to remove the sword of Damocles from our A&E department.
I'm grateful for that intervention. It saves me making the same point. In fact, the Secretary of State came to Ilford, to my honourable friend's constituency, during the election campaign for a private Conservative Party function. And he was asked by the local paper, the Ilford Recorder, about the plans to close the A&E at King George Hospital. And he said, quote, it would not be closed, there were no plans to close it in the, quote, foreseeable future. Now, I don't know how big the crystal ball is. I don't know what kind of telescope the Secretary of State has and which end he's looking through. The fact is, foreseeable does not necessarily mean it's not going to close in 2019. If it is not going to close in the near future, or even the medium-term future, why not lift the cloud of uncertainty over the staff and over the planning process? And secondly, then we could have a serious look at the draft Stability and Transformation Plan for North East London, which is predicated as part of its proposals on the closure of the A&E at King George Hospital. In January, the Trust wrote a letter saying that it is our intention to make the changes by 2019, but please be assured nothing will happen until we are fully satisfied all necessary resources are in place, including the additional capacity at neighbouring hospitals, and we've made sure it is safe for our patients. In the meantime, the existing A&E facilities at King George will continue to operate as now. Now, the reality is there is no additional resource going in than the capital that would be required to provide the beds for 400 patients at King George overall. And we are in a very uncertain future. If the A&E was to be closed, where would those patients go? There would be need for capital investment at Queen's. Yeah. There would also be need for big capital investment at Whipps Cross. And that would take time and resources at a time when NHS budgets are seriously pressed. And we still have that huge deficit within our regional health economy. So why not take that issue off the agenda? And my friend and I wrote jointly a letter to the Secretary of State with the leader of our council, Councillor Jazz Apple, leader of Redbridge Council, last month, requesting that the Secretary of State reverse the decision taken by his predecessor formally to allow certainty and allow planning on a more sensible basis than we currently have. Last week, one of our health campaigners who put various questions and freedom of information requests, Andy Walker, who's a very persistent campaigner, received a response from the Barking, Havering and Redbridge Trust, which commented on this issue. And it also made clear the same formulation. We've been very clear, no changes will be made until we have the relevant assurance that it is safe to do so, and this remains the case. That formulation has been used for several years. It's like a stuck record. It is not safe to make the changes. It is not safe. Why not have a new approach, an imaginative approach that says, let's look about the social care. Let's look at the potential for developing the site. Let's look about collaboration between the mental health services of the North East London Foundation Trust and providing some particular forms of housing and support. And this area could be a model for a new way forward. I know from discussions I've had that there are people within various NHS organisations who are currently working on possibilities of this kind. But they can't go any further than possible explorations whilst this cloud of the threat to close the A&E still lies on the table. Yeah. If the Secretary of State would take that off the table, then we could have some serious discussions about improvements to health facilities, not just dealing with the A&E, but also trying to deal with other issues. We have, on the King George site at this moment, we also have an urgent care centre, which just recently had a CQC inspection and was rated as requires improvement. And this is an indication, again, of the problems that we face. I, in my constituency, have a lot of inadequate GP facilities. I have lots of problems with people coming to me complaining that they can't get through. Primary care has a crisis in North East London of retention, of recruitment, of standards of services. Again, if we could have an imaginative use of the facilities at the King George Hospital site, we could make a big difference to primary care as well as to the acute services and the mental health services next door. So my plea to the Minister, to the Government, is take the closure of the A&E off the table and let us then work in a collaborative way to improve the NHS in North East London and in my constituency.
Minister of State at the Department of Health, Mr. Philip Dunn, to reply.
Mr. Speaker, thank you very much. It's a pleasure to serve under you this evening and to have another debate sponsored by the Honourable Member for Ilford South, and I congratulate him for his tenacity in keeping the subject of the King George Hospital at the forefront of health ministers' minds in recent years, not least during my tenure. As he rightly said earlier on, we had a meeting in February with myself and my former colleague David Moat to discuss many of the issues he's raised this evening. So I hope he will forgive me if some of what I say he's heard before from me, but his honourable friend and the honourable gentleman, the member for Ilford North, I congratulate him on joining us this evening, and he obviously has experience of these matters as well, given his role in the local council. I'd like to start by joining the honourable gentleman in paying tribute to the achievement of all of the staff and the management involved at the Barking, Havering and Redbridge University Hospitals NHS Trust in exiting special measures after what undoubtedly has been a long journey for them over the last 3 years. I was very pleased that they were able to exit special measures in March this year, and it is a huge tribute to everyone involved in ensuring that they were focused on the areas where the CQC had identified not the best practice, and they've focused on improving the deficiencies, and the fact that they were awarded an improved rating enabled us to take that decision. And I think I also join him in congratulating the quality of management now in place on a substantive basis in the Trust, at least one of whose members has himself been a beneficiary of treatment, I think for a different complaint to the Honourable Gentleman had in the urgent treatment centre, intermediate treatment centre, but a very substantial experience, and all credit to that member of the executive team. He has touched on a couple of clouds, as he described them, which I will touch on before I get into the substance of my response. And the first was the Intermediate Treatment Centre, which provides elective and planned procedures provided by an independent provider, Care UK. And we do, as he will appreciate, since in fact, under the previous Labour government, when the independent sector was provided capacity to support the NHS in a number of areas, we've had a policy of allowing independent providers to be commissioned to undertake care, and this is a matter for the local commissioners in his area to do so. And it's not for me to tell them who are the best providers to be able to undertake care. I'm very pleased that he was a beneficiary of some of that care, and it will be up to the commissioners working with the NHS to decide who is best to provide services in his area as they come up for renewal from time to time. He also referred to the social care challenge, which exists in North East London, as it does in many other parts of the country. That's why we decided in the budget in March of this year to inject an additional £1 billion into adult social care budgets of local authorities across the country, and a further £1 billion in the next financial year, and last week announced some measures to scrutinise the performance of local authorities in managing those budgets, in particular so that they contribute to the patient flow challenge which we experience in many of our hospitals, including the King George, of having patients occupying hospital beds in acute settings who have no medical reason to continue to be there because of the challenge of providing placements into the community. And it's important that there is closer integration with social care through the local authorities, but also, as he rightly identifies, through other NHS providers, in particular if they're co-located on the site. And I think what he describes as an opportunity for the North East London NHS Foundation Trust to work alongside BHR in trying to smooth the passage and find other opportunities in the community for more appropriate patient flow is very interesting. And I very much hope that he is engaging with the STP leadership to try to put some of these imaginative ideas forward in the hope that some of them, they will be assessed appropriately when looking at providing the future pattern of healthcare in his area. The Honourable Gentleman is focused mostly about the challenge, his remarks this evening about the challenge to the A&E at King George, and I'd like to spend most of the rest of my remarks in trying to address his concerns as best I can. He will appreciate that across the country the NHS is coming together through the sustainability and transformation plans as published at the end of last year to try to identify the right pattern of care across an individual NHS footprint. And North East London has come together within the STP for that area. And it is our view that this is the right way to try to encourage a more holistic way of looking at the future provision of NHS services, that it needs to be led by clinicians and led by those responsible for managing NHS organisations, and to work in a collaborative and a perhaps more open way than in the past with local authorities who have their part to play, as I was already describing, in facilitating the passage beyond hospital back into the community. And we are absolutely clear that any significant service change which arises out of the implementation of STP plans, if they were to get to that stage, must be subject to full public consultation, and proposals must meet the government's 4 reconfiguration tests, which are support from clinical commissioners, clarity on the clinical evidence base, a robust patient and public engagement, and support for patient choice. And there is additional NHS guidance, which means that proposed service reconfigurations should be tested for their impact on overall bed numbers in the area, which is a point that the Honourable Gentleman has identified appears to be lacking at present from the STP plan, and is something that I would urge him to continue to challenge within his area. Indeed.
I'm very grateful to the Minister for giving way. Can he clarify, therefore, that it would be his expectation that the STP process should now publicly consult on any proposal hereon to close the A&E at King George Hospital, and furthermore, that were the STP to recommend to ministers that the A&E should remain, that the ministers would heed that advice, and that the STP process should not be constrained by the decision that was made by Secretary of State in 2011?
Minister.
I'm going to have to disappoint the Honourable Gentleman, because I'm not in a position to second-guess the conclusions of the STP discussions and recommendations that they make. I think it is appropriate for them to take into account clinical decisions that have been made in the recent past, and the decision over the A&E at King George is one of those, and it is up to them to decide whether that's something that they intend to take forward as the STP evolves. It is right that the STP management look at the health provision in the round. They will be responsible for delivering health care to local residents, and they need to take into account all the information sources that they have available to them. So I don't think it is right to say that they have to necessarily reconsult on issues that are already been consulted on. They need to form a view as to what is the right configuration, and then use the available data sources that they have, and then go through the processes. And I will come on to trying to explain to him the process that, as I understand it, is now underway in his area. They are, of course, right, both Honourable Gentlemen who've been speaking earlier, that it was a decision back in October 2011 by the then Secretary of State, on advice from the Independent Reconfiguration Panel, who approved the proposal, that the North East London scheme should be allowed to proceed. But the Secretary of State at the time, and as repeated since by anybody who's asked the question of health authorities in the area, made it very clear that no changes were to take place until it was clinically safe to do so. And I believe that it's in that context that remarks which might have been made by the Secretary of State when visiting the area recently should be considered. There have been a number of changes since the decision was made, and the process that I just touched on, which is currently underway, has 4 elements to it. So first of all, the STP team are reviewing and revalidating the modelling used back in 2010 to ensure that the proposals that were then made remain appropriate, which is as one would expect them to do. Secondly, the governing members of the CCG boards, the Trust Board and the STP Board, will need to agree the business case that arises coming out of STP recommendations. Thirdly, once that has been achieved, if it is, both NHS England and NHS Improvement will be required to approve the business case. And finally, it's envisaged that there will be a clinically led gateway assurance team, an NHS construct, who will manage a series of gateway reviews at different stages of the process, from planning to implementation as the project proceeds, to assure system readiness and patient safety at every step of the way, should the decisions be taken in the intervening era to get there. I will.
Extremely grateful. Does he think that whole process could be completed by 2019?
Mr. State.
Again, I'm going to have to disappoint him. It's not for me to prejudge how long it would take. I think, in all honesty, it is most unlikely that would take place within less than 2 years. So it's conceivable that it would be concluded by the end of 2019, but I think it's a 2-year process is likely to be required as a minimum. In the meantime, CQC visits and reports will continue to take place on a routine basis. Now that the Trust has exited special measures, they'll be somewhat less frequent than during the period when they were in special measures. And any information coming out of that will also inform decisions that are taken by the Trust and by the STP area. I'd just like to, in the last comments that I make, just try to reassure honourable gentlemen and their residents that the proposals include a new urgent care centre at King George Hospital, which would provide emergency support to local residents for the majority of present attendances at the A&E, which would be handled by the urgent care centre. It would be blue light trauma and emergency cases requiring full emergency medical teams to provide the support to patients, which would take place at other hospitals in the area. So the majority of cases who currently are treated at King George would continue to do so, and the new urgent care centre would benefit from a number of improvements, including more space and access for diagnosis, X-ray, blood tests, and so on. And I hope that would provide the honourable gentleman with some reassurance that the facilities which would remain at King George would continue to provide the majority of their constituents with the care that they need, should they need it in an emergency.
Taking an intervention or concluded?
Very briefly, so what the Minister is saying is that the STP process shouldn't be constrained by the decision in 2011 if they think that was the wrong decision.
It should be informed by the decisions taken in 2010, but it will be up to today's STP leadership to decide what to do.
The question is that this House do now adjourn. As many as other opinions say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it.